SITREP World Briefing for July 3, 2026. Russia launched a mass missile and drone attack on Kyiv, Ukraine, killing at least 30 people and striking targets across the capital. The assault hit residential areas, including a 9-story apartment building that was left completely destroyed, and turned a wide section of Kyiv into a rescue zone as emergency crews dug through concrete, twisted metal, and shattered household debris for survivors. By Friday, rescuers were still clearing the rubble in Kyiv, and authorities marked a day of mourning by lowering flags to half-staff across the city. The continued search highlighted the scale of the strike and the likelihood that the casualty toll could rise further, because crews were still working through the remains of the flattened apartment block and other damaged sites. Kyiv has been repeatedly targeted since Russia's full-scale invasion began in 2022. The latest attack involved Russia combining missiles and drones in large salvos intended to overwhelm air defenses and spread damage over a wide urban area. The strike is likely to intensify Ukrainian appeals for additional air defense support and highlight the vulnerability of civilian infrastructure in the capital during periods of escalated Russian attacks. A bomb blast struck a cafe near the Palace of Justice in Damascus, Syria, killing multiple people in an attack close to one of the capital's major government buildings. Syrian state media reported a rising death toll, with public accounts putting the number of dead at least 6 and later counts higher. The explosion sent security concerns back to the forefront in a city that remains the political center of a country still emerging from years of war and state upheaval. The site of the blast added to the significance of the attack. The Palace of Justice is a prominent state institution in Damascus, and a bombing at a nearby cafe suggested that the perpetrators, who had not been immediately identified, were willing to strike in a heavily symbolic part of the capital. An explosion near such a landmark challenges the government's claim to secure its administrative heart. The bombing came just as Syria was navigating a sensitive political moment, a day after the first parliament since the fall of longtime leader Bashar al-Assad began to take shape. The timing gave the explosion added national importance because any successful attack in Damascus now lands amid efforts to project institutional continuity and political transition. The blast is likely to sharpen scrutiny of security arrangements in central Damascus and complicate attempts by Syria's new authorities to present the capital as firmly under control. The Democratic Republic of Congo has begun a clinical trial of experimental Ebola treatments as a fast-growing outbreak spreads across the country's northeast and pushes the death toll above 400. Health authorities and international partners opened the study while confirmed infections continued to rise, with World Health Organization data cited this week showing 106 confirmed cases, 301 suspected cases, and 438 deaths. The launch marks a significant step because doctors are trying to test therapies during an active emergency, rather than after transmission has been brought under control. The urgency of the trial increased after the virus reached Kisangani, Democratic Republic of Congo, a major city that serves as a transport and commercial hub for the wider northeastern region. The confirmation of a first case there showed that the outbreak was no longer confined to more remote areas, raising the risk that river, road, and air links could complicate containment. In a country where previous Ebola responses have depended on rapid isolation, contact tracing, and community trust, spread into a larger urban center raises the stakes for both treatment capacity and public health surveillance. Congo has battled repeated Ebola epidemics over the past decade, but each new surge tests an already stretched health system in a region affected by insecurity, difficult logistics, and mistrust of authorities. Starting a treatment trial during a worsening outbreak offers a chance to improve survival rates if the therapies prove effective. With hundreds already dead and transmission widening geographically, officials are trying to combine research, bedside care, and classic outbreak control quickly enough to prevent the Northeast from becoming the center of a larger national emergency. France reported a sharp increase in deaths after a record-breaking June heat wave, with the Public Health Authority saying mortality rose by nearly 30% during the week beginning June 22nd, the peak of the extreme temperatures. The latest data added urgency to a national debate over how quickly France must adapt its homes, cities, workplaces, and care systems to hotter summers. The heat wave has also intensified scrutiny of protections for workers exposed to high temperatures, especially in outdoor and physically demanding jobs. Attention has turned to Spain, where measures designed for extreme weather are now being discussed in France as a possible model, including a proposal for climate leave. The comparison matters because French labor rules have long focused more on cold weather and safety hazards than on prolonged heat stress. France's recurring struggle with deadly summer heat has shaped public policy since the catastrophic 2003 heat wave. Questions now extend beyond emergency warnings to the design of schools, housing, transport, work schedules, and urban public space. This week's debate has moved from short-term crisis management toward a larger argument over how the French state, employers, and local governments should prepare for a hotter baseline climate. Sources and the full written briefing are available at sitrepbrief.com.